I've always been a curious person. And amongst the quirkier things I've been open to experiencing in my life is coffee with a giant snake around my neck, reading a novel on vampire romances, and zorbing around. I'm especially curious when it comes to food and drink, and I quite enjoy local liqueurs or local food traditions, learning about their relevance to communities. But there is one thing that I've never felt tempted to try in my life, and that's been a cigarette. This is Sonali Acharji, and you are listening to Health Wealth, a podcast to help you understand the science behind health and well being. It's surprising I've never smoked or even wanted to, considering all my best friends are chain smokers. I've literally lost count of how many times I've accompanied people in the middle of the night for a quick puff. And I think perhaps two things have curbed my enthusiasm for them. One, my father smoked, and I developed a distaste for the smell from a very early age onwards. And two, I have witnessed my nearest and dearest really struggle to quit. I can recall a friend once called me up in the middle of the night and she was just crying away. And she said, "You know what? I don't even enjoy the smell. This makes me feel sick, but I can't stop." I've also met so many doctors who have recounted stories of how tobacco has impacted the lungs, the heart, the brains, the taste buds of patients. So when you get to see these effects of cigarettes, it really cautions you against experimenting with it. But naturally, this choice is a result of my personality and the life experiences I have had. Not everyone thinks the same way. In fact, most people who get addicted to tobacco truly believe when they started that this will not happen to me. I will be able to control myself. This is just a one off try, something to fit in, something to combat stress. I'll be able to stop when I want to. But that doesn't happen because from that very first puff onwards, your brain is already trained to crave nicotine, the stimulant found in tobacco. In fact, the latest global adult tobacco survey in India found that more than half, about 55% of smokers, want to quit but haven't been able to. And that's why even today, nearly a third of adult Indians use tobacco. Every 10th adult smokes tobacco. But sometimes, we all know that cigarettes are not good for you. There's been so much of negative press on it. So sometimes we start to look for something better. A lot of people have found that switching to vape is vastly easier than quitting tobacco entirely. In fact, a study of 840 educated young adults by the George Institute for Global Health in India found that amongst those who did not vape currently, 31% were curious and 23% said, "We're going to start using them next year." And experts say that the reason for this very high susceptibility towards vape is that people genuinely believe they're less harmful than cigarettes. And vape is more accepted, even in some non smoking areas. You don't reek of smoke. And then add to this the mix that it's very strongly marketed as something very cool. We have about 300,000 vapors in this country. And according to market research firm PNS Intelligence, this figure is going to double in 2024, which is just around the corner. Even though we have banned the sale and manufacturing of vapes, there was a survey done by Think Change Forum in this year in July, and they found 96% of students between 14 to 17 didn't know that vapes were banned, and 89% of them didn't think they were harmful. And then there's a third, equally popular substitute for tobacco. You can't quit cigarettes, so you have to find something else. It's called marijuana joints. And I've had friends tell me these are non-addictive, they're great for relaxing. They almost talk about it as if it's healthy. We have 27 million bhang users in India, and roughly 16 million use illegal cannabis products like hash and weed. While there is research that indicates people turn to cigarettes, vape, or joints to handle stress, they're also extremely popular at parties. In fact, a friend told me that there's nothing more relaxing than hot chocolate and a joint to bring in the new year. So, with another new year just down the line, I thought perhaps this is a good time to ask a doctor, what can science and medicine tell us about the impact of cigarettes, vape, and marijuana? And are any of them actually healthier than the other? To answer this, I have with me Dr. Vishal Rastogi. He is the Director of Interventional Cardiology at Fortis Hospital in Okhla, which is in Delhi. Hello, doctor.
Hello, Sonali.
Thank you so much for your time today.
It's a pleasure being here.
So, this is the time of the year when socialization peaks and we want to introspect, we want to be with friends, we want to bring in the new year. And if we feel that in order to do these things, we need tobacco or vape or marijuana, that's all right. I mean, we're not here to condemn something per se, but I think when people make a choice, they should make a very informed choice that, let's not do it believing this is healthy for us. So perhaps, we could just start by having a conversation on tobacco. What does tobacco do? From the very first puff, what does this do to my body?
This is a very valid point, Sonali. In fact, according to WHO, tobacco kills approximately 8 million people worldwide on a yearly basis. And this includes 1.3 million people who are not smoking. They are killed because of the passively they are taking smoke from their peers, their colleagues, or their family.
Mm-hmm.
So, and smoking is the leading cause of preventable death worldwide. So, tobacco is really dangerous, and it is known that it causes cancer, it causes a lot of heart problems. So, as soon as we start smoking,
Mm-hmm.
the from the very puff, the heart rate increases, the blood pressure goes up, and that's why it is recommended that once you go to the doctor, you should not measure your blood pressure after you have smoked, because smoking will increase your blood pressure in any case. And this is according, this is contrary to the popular belief which says that smoking is going to calm you down. Most of the people will say that I smoke so that I can relax from my stressful environment.
Yes.
In fact, this is not what happens to the body. The body is, you can see the pulse, you can see the blood pressure, and it's not what's happening. In fact, the tobacco, because of its addictive issues,
Mm-hmm.
if you're not smoking, that leads to withdrawal symptoms, which
Mm-hmm.
makes you fidgety, which makes you stressed.
Mm-hmm.
That's why once you smoke, that feels like calming effect,
Yeah.
though the body per se is not calmed down. The heart, the smoke or the tobacco or nicotine, whatever is there, that
Mm-hmm.
leads to sympathetic overactivity. And sympathetic overactivity is that system which is causing all bad things. We say that you should do yoga, we
Yeah.
should do breathing practices, we
Mm-hmm.
should do all those exercises which is stimulate the parasympathetic system. So
Mm-hmm.
parasympathetic system is actually beneficial for heart and overall body health,
Yeah.
while sympathetic system is bad. So smoking or nicotine stimulates the sympathetic system, which
Mm-hmm.
leads to worsening of the cardiac problems.
Cigarettes also have a lot of other harmful chemicals in them as well, right? We think it's just tobacco, but there are other substances which are harmful.
Definitely. So the cigarette work by
Mm-hmm.
burning tobacco, and that leads to production of more than 9,000 chemicals which are inhaled. And
Mm-hmm.
out of that, at least 70 are clearly carcinogenic. They are known carcinogens, and when we inhale them, they are harming the body. So it's not just the nicotine which is there, but also a lot of other products which are produced like tar
Mm-hmm.
and other things, like there are particulate matters, there are carbon monoxide, and there are a lot of other substances which are harmful in a
Mm-hmm.
smoke.
So this PM 2.5, which we're running away from the pollution all the time, we're taking it in through the cigarettes, is it?
Yes, so carbon monoxide is one
Yeah.
of the very important substance, and that causes very bad effect on the heart.
Mm-hmm.
What it does actually is that it causes relative hypoxemia. What carbon monoxide is, it can
Oh,
combine with the hemoglobin,
right.
and it can replace oxygen. So hemoglobin is responsible for supplying oxygen
Mm-hmm.
to different parts of the body,
Mm-hmm.
and carbon monoxide has higher affinity to this hemoglobin.
Mm-hmm.
So now the even if the oxygen is sufficient in the body, and we don't have anemia, we don't have
Mm-hmm.
low hemoglobin, but
Mm-hmm.
this hemoglobin is not available for oxygen. This is bound to carbon monoxide.
Mm-hmm.
That's why the oxygen supply to different parts of the body is very, very limited.
Mm-hmm.
And patients who are smoking, they get, this lack of oxygen to the organs, including heart, is harmful, because
Mm-hmm.
the anginal episode, whatever is, what we call as angina, is
Mm-hmm.
because of the lack of oxygen to the tissue,
Mm-hmm.
to the heart muscle. And
Mm-hmm.
that can happen because you have replaced this oxygen with the carbon monoxide. So that is another important thing which is there,
Mm-hmm.
that the carbon monoxide leads to various ill effects on the heart
Yeah.
by replacing oxygen.
Yeah. So, I mean, when you do surgeries, and you cut open a person, can you tell if someone's been smoking? Like, can you actually see visible signs of it?
So, the this is very clear that the lungs definitely get
Mm-hmm.
very, very affected. And we,
Mm-hmm.
I am a part of the transplant program also, and we do
Mm-hmm.
heart and lung transplant. But
Yeah.
then the lungs of a person, deceased donor, cannot be taken if the person was smoking, because the
Okay.
lungs are all black and they are all damaged, and they
Right.
cannot be used in a fresh person, and they cannot be used into a patient.
Mm-hmm.
So these lungs are really unusable, because they have got damaged because of these chronic smoking.
Right.
And also in the arteries, we have seen this, that the coronary artery disease occurs
Mm-hmm.
much younger, at a much younger age, in those patients who've been smoking. In fact, as we routinely see patients who are 25 years or 30 years of age, they come back with a heart attack without even having a
Oh
definite
gosh.
blockages. So this smoke actually leads to clot formation inside the arteries,
Mm-hmm.
and that can cause heart attack and damage to the heart
Yeah.
without the actual blockage.
Yeah. No, actually, I remember somebody in my family telling me a story that, oh, my grandfather lived till 98 and he smoked regularly. But the funny thing was, when he actually had an episode, there was nothing anyone could do to save him. It was like absolutely the end then and there. You couldn't
So
use, you couldn't even give him anesthesia. He was just so badly, his organs were just melting away. And the quality of his life was so different as well because of smoking.
So Sonali, we hear this, all the time, that
Mm,
Dr. Sab, everybody smokes, and people who are smoking, even they are not having heart attack. Why I had a
yeah.
heart attack? So this is something which is, we have to see in a broader perspective. There is not just one factor which leads to heart attack. There can
Mm,
be, multiple other things, including your family history, your genetics, your blood pressure, sugar, and other things,
mm,
which can contribute to heart attack. And smoking is one of those biggest risk factor which a person may have. In fact, there are a lot of factors which we can't modify. There can be
right.
something like, your genes, you cannot modify that. But
Mm,
the factors which you can modify,
yeah.
that should be modified to an extent that
Mm,
the effect of other factors is negated. So if somebody, despite smoking, did not have a heart attack, that does not
mm-hmm.
mean that everybody should start smoking,
Yeah.
because the person may be carrying very good genes, and he did not have did not allow smoke to cause heart attack in that person.
Yeah.
But not everybody, not an average person has that kind of
Yeah.
genes. So and we are talking about statistics here, that if you smoke even 5 cigarettes a day,
Mm,
even that much smoking, people will say that, I don't smoke, I don't smoke that much, I just smoke occasionally, I smoke one cigarette in the morning
mm-hmm.
while I'm freshening up, and the one after
Yeah.
lunch and one after dinner. Even if you're smoking as little as 3 to 4 cigarettes a day,
Mm.
even then your risk of heart attacks are more than double that of the normal person.
Yeah, and as it is, as Indians, we already are quite high susceptibility to heart attacks, right?
Yeah, yeah, definitely.
And I also think that sometimes what we don't talk about is the diet and the exercise of some smokers. Sometimes that is so good that that by itself might be negating some of the effect. But
So,
you know,
in fact, that's also very interesting point.
mm,
Smokers may have, some smokers may be, not smoking inside the house, and they may
mm,
be going out and smoking. And
mm,
even, their lifestyle may not be as sedentary as somebody who's, not smoking and just on the
yeah,
couch and watching
yeah,
television and spoiling life. So
mm,
that's different. But then otherwise, if you see, the smokers will have reduced exercise capacity as well, and they cannot exercise that much. So smoking has ill effects on all the organs of the body.
mm-hmm,
And the effect will come into picture. It's said that if people don't quit,
mm.
1 out of 3 person is going to die because of this habit.
And also, I mean, one of the lesser known things that I know, a smoker recently told me is that it's changed his taste buds. He
Oh, yes.
tastes differently, which that, because we know somewhere that, okay, heart, lungs, these seem like a direct impact, almost cancer. But the fact that your taste buds or even your brain, I believe it impacts your memory recall.
It does. So smoke is known to cause taste failures, because
Mhm,
you're smoking and you're taking this fumes inside, which are actually damaging your taste buds in the long run.
mhm,
Everything goes through your mouth itself, and then you're burning your mouth day in day
mhm.
out, 20 cigarettes a day,
Yeah.
and this is going to damage your taste buds and also brain. In fact, brain gets affected in more than one way. This,
Yeah.
there are the more instances of stroke in those patients who smoke.
Mhm,
In fact, stroke can be either absolutely, it can be devastating,
mhm,
and patient may have a paralysis attack. But
mhm,
more commonly, we may have strokes which are not recognized otherwise, but they are
mhm.
causing dementia. They're causing damage to the brain cells one by one. And this is very common in smokers, and they have memory loss and dementia also after years of smoking.
Yeah. And what about vape? Now this seems to be the new cigarette. Everyone thinks vaping is, the in thing. It's less harmful. In fact, I've actually had full arguments about it. They say it's just nicotine. What's wrong with nicotine? Nicotine doesn't do anything bad to your body, does it? Is that true?
So this can be seen in multiple ways. Number one, if you are smoking cigarettes and you are really addicted to it, and you have tried everything else, which includes
Mm-hmm.
uh, psychological help, which includes nicotine patch, which includes other tablets which are used, anti-abuse drugs, and still you're not able to quit, and then
Mm-hmm.
you are taking vape as a quitting mechanism, then it is partly acceptable, because of
Mm-hmm.
course vape does not contain all the harmful chemicals. It
Mm-hmm.
contains harmful chemicals, because vape is what? Vape
Mm-hmm.
is actually, you're vaporizing, or you're, there's a substance which is filled in the cigarette, and it's heated and it's vaporized,
Mm-hmm.
and that produces smoke. So you intake nicotine
Mm-hmm.
through with some chemicals, and these chemicals are used not only to make nicotine less hit to the throat, but
Right.
also to give it a smooth texture, to give it some flavors. And in fact, there was a lot of alarm in 2 3 years back, when there was a problem called EVALI, which is the
Mm-hmm.
e-cigarette and vape associated lung injury, which was
Okay.
definitely because of only e-cigarettes and vapes. And it was because they were smoking THC. THC is tetrahydrocannabinol, which
Mm-hmm.
is we've discussed that also. But
Yeah.
then that had some stabilizing substances, and that led to this damage, which is permanent scarring into the lungs. And
Mm-hmm.
also a lot of vapes have diacetyl subcompounds, which gives it a buttery flavor, and that leads to so-called popcorn lungs, which are the permanent scarring of the lung tissue also. Also
Popcorn
there are
lungs. So you have what? Pieces
you
of
have
scar tissues in your lungs
in the lungs, yes. And
from
also
vapes.
there are from vapes, and there are
This is just
carcinogens in vapes, which includes formaldehyde, which includes acetaldehyde, which includes
any standard
nitrosamines.
vape, because I've also had people tell me that it's the vapes which have flavoring in them which is harmful. The ones without flavoring is absolutely fine.
Right. So, different vapes will have different
Hmm.
substances, and different flavors will have different effects. And
Right.
unfortunately, this has not been studied that well. And number
Hmm.
two, it is not regulated. So you
Hmm.
can get vape at each and every nook and corner, and
Yeah.
you don't know about the authenticity, whether they are
Right.
filling the pods themselves, whether they are getting it from a
What's
reliable
in it?
source, or
Right. Yeah.
where they're
Yeah.
getting for.
Yeah.
So and we just go by the flavor, by the texture, and how
Hmm.
smooth it feels, and how satisfying it is,
Yeah.
but we don't know what is there inside, because nobody has done that chemical
Yeah.
analysis inside that. But what
Yeah.
I'm talking about generally, that this has been found associated with vaping, that the vaping is not absolutely safe. It does not have those 9,000 chemicals which cigarette has. It does not burn anything, so there's no tar in it. But
Mm.
still, it has problems related to those chemicals which are added, and also because of nicotine. When we are talking about nicotine is not a very innocent substance. Of course,
Hmm.
nicotine is used in vapes, because otherwise a person who's thinking of quitting will not quit, because nicotine is what which is addictive,
Hmm.
and which was forcing a person to smoke cigarette after cigarette again and again. So
Hmm.
that's why they have to have this nicotine there. But then this nicotine intake can be much higher with a vape, because you can increase the concentration inside that e-cigarette, and
Mm-hmm.
you can increase the voltage by which you can inhale more amount of nicotine per vape than you could do with a cigarette. So
Mm-hmm.
nicotine, and we have discussed that nicotine is not also, it's not harmless, because it leads to overactivity of the sympathetic system,
Mm-hmm.
which includes the it increases the heart rate, it increases blood pressure, and also it causes vasoconstriction inside the coronary arteries, so it reduces the blood flow to the heart. So nicotine per se is not
Like
a
heart
harm.
failure. Is
Yes,
what
heart
you're
failure
saying?
also,
Okay.
because over sympathetic activity will reduce remodeling. So if the heart
Mm-hmm.
is damaged and you are
Mm-hmm.
taking nicotine, then the remodeling will lead to heart failure also, and also it can lead to arrhythmias. Arrhythmias are irregular fast heart rate, and a lot of patients die because of atrial fibrillation, and other arrhythmias on a yearly basis. So and nicotine is associated with arrhythmias also. Also, as I discussed, that it can lead to thrombus formation inside the coronary arteries without having much blockage. So it's a thrombogenic material,
Which means blood
uh,
clots, is it?
blood
Right.
clots, and
Right.
also, of course, it can lead to bad lipid profile and other things which
Mm-hmm.
can contribute indirectly to heart attacks and strokes. So nicotine is also not harmless.
Right. You mentioned formaldehyde, right? It's a very interesting story that I was at a get together and somebody was vaping, and there was a dentist present from Maulana Azad, and she smelled it and she said, "I can smell formaldehyde." And he said, "What's wrong with it? I mean, it's the same smell that we get when we go to our salons because they use it for straightening the hair." And she said, "Do you know we use them to petrify bodies in medical school? It's not just because you use it on your hair doesn't mean it's fine to
You can take
ingest
it.
it." So what happens when you ingest formaldehyde?
So formaldehyde is definitely one of the important carcinogens. It
Hmm.
is
It's a
degraded in the
carcinogen,
body.
is it?
Yes, yes, yes. It can cause cancer. So
Hmm.
formaldehyde is a very known and potent carcinogen, and it can lead to cancer into lungs and other organs also. And
Yeah.
also, it can cause narrowing of the blood vessels and scarring in the blood vessels. So
Hmm.
that's another important substance that we should be careful of.
Yeah, I think it's because we're familiar with the smell. Somewhere we feel that no, no, this is a safe chemical, but we don't realize one is going on our hair and one's going
Mhm.
inside of us, and it's a
Yeah.
vastly different impact.
And
Um,
Sonali,
yeah.
again, we discussed that if vaping is still acceptable, slightly acceptable, if you use it to quit.
Hmm.
Unfortunately, a lot of people are not able to quit. In
No.
fact, in a study, it was found that people continue to use cigarette as well as vape both, and they are not able to quit. In fact, if once they try that, okay, they are not smoking, and they say that they stop vaping, as soon as they
Hmm.
think of lowering down, they again go back to vape,
Hmm.
to cigarette. So this is something which is on a very weak premise, that people use it to quit, but they are not able to quit. In
Yeah.
fact, the problem that you mentioned, that the marketing for vape is so much, that when I was once I was asked this question in my clinic by a patient, and I thought that I let me do some research on it so that I can give
Yeah.
a proper informed answer. And then I was on the internet, and then my daughter, who's a teenage, she says that, oh, you're researching about vape, uh, you know tell me what you want to know. So youngsters who are
Yeah.
not
Yeah.
who are not exposed to many things, they are
Yeah.
exposed to these kind of conversations
Yeah.
in their schools,
Yeah.
and they know about it, and then it definitely generates curiosity. And these vaping industry, there's these people who are marketing these cigarettes, they have been accused, or they've done this, that they have used these school events, they've used various social events to promote their e-cigarettes, and they're targeting these younger generation. In
Yeah.
fact, a lot of companies in the US had to be shut down by the authorities because of these marketing tactics.
Something which isn't marketed, but is equally popular is marijuana joints. I suppose it's marketed through word of mouth and through, if you go to the hill stations, you'll see people talking about how the gods did marijuana, so it's fine if us humans do it. Um, is marijuana healthy?
So, marijuana is something which is very controversial.
Hmm.
In fact, it has medicinal properties, and that's why the production is regulated by the government.
Mm-hmm.
In fact, this plant, which is cannabis sativa,
Mm-hmm.
it has multiple components, which includes leaves, which includes stems, which includes the flowers, and different parts have different properties. But one property is there always, which is addictive. And these all these agents, they're known as psychedelic substances because they cause certain changes in the brain chemicals
Mm-hmm.
that leads you to sometimes hallucinate, sometimes feel differently, sometimes feel light, sometimes feel, and the effect also varies according to the amount consumed.
Mm-hmm.
So, marijuana again is legal in some countries. And in fact, in certain states in the US, it was legal. And in those states, you'll be surprised to know that the organ transplantation rate increased.
Mm-hmm.
Oh, how does this happen? Suddenly there are certain donors which are available for heart. There, of course, there are a lot of recipients which need heart, and there are certain donors which are available. But these rates were static, and nothing was done. They wanted to improve survival of donors, but they couldn't, and they were static. But they found that in certain states, the donation rate has gone up because
Mm-hmm.
more people were dying with road traffic accidents because they were
Yeah.
consuming marijuana.
Mm-hmm.
So this is something which is not safe. it
Mm-hmm.
it has addictive properties. It causes a lot of changes in the brain, and
Mm-hmm.
also same thing as nicotine does to the heart. It also leads to effects on the heart. But
Yeah.
more than that, it can be really really harmful if you're driving after taking marijuana, because
Mm-hmm.
it can get you killed.
Mm-hmm. Something, what I came to realize during the COVID pandemic, that there was a time when health was really in focus. And I was talking to a doctor, and we knew all the comorbidities, the popular ones, diabetes, age, cardiovascular disease. And he said, how come no one is talking about those who smoke, those who vape, and those who use marijuana? Because he said in his, when he was working, the most difficult cases he had were smokers and weed users. Why is that? What did it do? It lowered the immunity, or what was the impact?
So yes, this is again one aspect which is not very clearly studied. We have noticed this. We know this, that these patients are very difficult to treat because it
Mhm.
definitely, as we can say in a local in a more common language, eats up the body from inside.
Yeah.
You may be looking healthy, but your organs are working at peak capacity, and a
Mm-hmm.
slight push or slight problem, which could be even liver disease, which could be even simple infection of the gut,
Mm-hmm.
simple problem, can
Mm-hmm.
really take you to the ICU, and you will find that whole of the body is not able to cope up, and you find that the person is really very weak from inside. Whether this is related to immunity or whether this is related to the organ dysfunction that it causes, we don't
Mm-hmm.
know. But people who are using these uh, who are abusing these substances, they are definitely very very sick from
Yeah.
inside, and they don't respond that well to the treatment.
Yeah, no, I remember that one test that everyone was doing was CRP, or C reactive protein, at the time. And a friend and I did it. And because she smoked, she didn't have COVID, but her CRP was 20 times higher than mine. And
Yes, so
I was shocked. I mean, we actually thought she had COVID, and then we did like two tests, and then we realized, no, this is just her natural state of being.
yes, so CRP is a very important marker or inflammation.
Mm.
We knew that COVID causes inflammation. That's
Mm-hmm.
why we were worried about and a lot of problems that COVID caused were
Yeah,
related to this inflammation.
yeah,
And in
yeah.
fact, people who had COVID, this inflammation is still persisting in a lot of them, and CRPs
Mm-hmm.
are still high, and patients are
Mm-hmm.
still having these heart attacks while they are exercising.
Yeah,
So this is something which is a gift of from that COVID era. But then people who smoke, they definitely
they
have higher
naturally have
CRP
a
levels.
higher one.
Yes, because the smoking also causes similar inflammation in the body, which
Mm-hmm.
is reflected in the form of high CRP levels.
Mm-hmm. So we can't say that one is healthier than the other. At best, cigarette smoking might be the worst, but the others are harmful in their own way. Is that right?
Perfect, because if you are not smoking, if you are, and in any case, youngsters should never be exposed to these substances,
Yeah.
which is
Yeah.
which is happening nowadays.
Mm.
So if somebody is thinking of starting, or
Mm.
somebody is thinking that they should experience this, this is
Mm-hmm.
a very, very bad idea, because
And
all of them are bad.
what if it's just experiencing it just that one time, or maybe three, four times? Is that dangerous if one doesn't get addicted to it? Or is that just temporary sort of harm?
So as I said, that in theoretically,
Mm.
if you take one or two cigarettes
Mm.
and you don't continue to smoke,
Mm.
then the harm is not long lasting.
Mm.
But this is a very, very theoretical question, because this doesn't happen.
Mm.
Every smoker who's smoking today thought that he'll just take one or two puff and experience it, then quit.
Mm-hmm.
Nobody thought that they would be burning their health
Yeah.
and their money on
Yeah.
cigarettes day after
Yeah.
day after day.
No, we really don't think. But I suppose I'd like to end it on something slightly useful for those who have managed to quit. If, say, I've been a chain smoker for 5 or 10 years and I've quit, what can I do for the remainder of my life? Say, I have 30, 40 years to go. What can I do to sort of do away with those negative effects? Or how can I improve my life going forward? Or will those
So,
effects
Sonali,
just be permanent, you know?
no, so Sonali, the some of the damage that has happened to the lungs,
Hmm.
that will remain permanently.
Mm-hmm.
The blockages which have happened today,
Mm-hmm.
which are there in your arteries today, they
Yeah.
will remain permanently.
Mm-hmm.
Uh, the heart attack that has happened and the scar that it's caused will remain. But your risk of having heart attack, or your risk of having subsequent events or
Mm-hmm.
subsequent problems, starts to reduce the moment you quit. And in fact, your risk of stroke and your risk of having a heart attack, because you were smoking earlier,
Right.
is almost equal to someone who's not smoking after 5 years you have quit. So it is something which is very encouraging.
Mm-hmm.
It is never too late to quit.
Mm-hmm.
Whenever you decide to quit, you can get the benefit today. And also, once you have quit, you should continue to have regular exercise, diet, and healthy lifestyle, which can reduce the chances further. You have
Yeah.
to strengthen your heart health. You have to strengthen your body health
Mm-hmm.
by these positive measures, so that the effects are further mitigated.
Yeah. You can't really stop people from doing what they want to, but I think this conversation is very important because, like I said, if somebody is going to make that choice, if they're going to take that puff of smoke, at least let it be an informed choice. Let them not do it out of misinformation or myths that this is healthier or this is not addictive. So thank you so much for sharing all that you have, sir. Thank you.
Thank you, Sonali. Thank you so much.
The most I have ever felt addicted to has been food, particularly stress eating, and it isn't nearly as powerful as tobacco, but some things overlap. Firstly, if you want to stop, you need tremendous willpower. Nothing else will get you through this. And secondly, you have to assert your boundaries because not everyone is going to understand the psychology of quitting. So if someone is smoking in front of you and you're trying to quit, or someone's dangling food under your nose and you want to stop overeating, you have every right to be rude then because you have to look after yourself. And I know this from personal experience and from those around me who have managed to quit smoking and other kinds of addiction. Having a support group of people who will help you in the way that you want to be helped, in a way that's actually benefiting you and not adding stress to you, that is extremely important. And for tobacco cessation or to stop smoking tobacco or using tobacco, there are a lot of support groups available, a lot of ex smokers who are there to help you. And all you have to do is go online, which all of us can do. Have you faced struggles with addiction of any kind, and how did you break free? I'd really like to hear about your health journey. Do write to us at pods@indiatoday.com, or you can message us on 8588 966 996. And if you enjoyed this episode, or if it brought anything meaningful to your life and well being, please do rate us on Apple, Google, or Spotify.